Good afternoon, all. Thanks so much for watching a recorded and abbreviated version of a previous session that was done earlier this week at the RHSC's annual membership meeting, Advocacy for Total Market Approaches. My name is Erin Seaver. I'm a Market Dynamics Advocacy Officer with PATH, and I'm going to offer just a very short, hopefully about 10-minute version of what we thought was a great joint session between the Market Development Approaches and Advocacy and Accountability working groups. I'd like to set the stage for this abbreviated version of the presentation with a quote from our colleagues USAID's Market Shaping Primer. I think it speaks really to the opportunity that we have. Global health is inextricably linked to the health of the marketplace that delivers life-saving products to low-income populations. And I think that last piece of the quote, low-income populations, is particularly critical. Before I jump into, I think, the meat of this slide and the meat of our presentation, I'd like to address what I like to refer to as the market-related word soup that we increasingly throw around in the global health community. And these are the terms related to markets, market dynamics, market development, market strengthening, market shaping, healthy markets, and the total market approach. And my intention in sort of addressing this market-related word soup is not to define each of these, but rather to highlight, I think, the increasing attention to markets in global health. And what do all of these terms have in common? The answer is not markets first, really that they utilize resources and increasingly public sector resources to make catalytic investments in the market, to change market practices or disrupt market structures, all in support of public health outcomes. And I think that's critical. So why is advocacy relevant to markets? Why would the MDA and the ANA working groups gather around the table in a joint working group session? I think at the highest level, we can all understand and see in our experiences that the political, legal, and regulatory environment shapes the market, and that be it product markets or others. Policies and regulations have important impacts on competition, innovation, trade, and investment in the market. As we all know, advocacy plays a fairly critical role in affecting change in public, legal, and regulatory policies. So, as we're a bit pressed for time in this abbreviated recorded version here, I'll be fairly brief and say in 4 points why I believe that advocacy is needed to affect change in the marketplace. One, building enabling environments. I think it's absolutely critical that we build enabling environments for the private sector provision of reproductive and maternal health products. 2, support government stewardship of both the public and private sectors. 3, ensure financial sustainability of our public health programs. And 4, safeguard health. And that is both having governments be accountable to the health of their populations and appropriately regulating the private sector in the provision of reproductive and maternal health services. So what is the value proposition for advocacy for market strengthening? As we look at this fairly visual slide here, why should we care? All of us are fairly overburdened and overworked in the global health space. Why do we also need to care about advocacy for market strengthening? And I would be fairly remiss if I didn't at first up front address what I believe has been a bit of a historical tension or hesitation on the part of our global health community to better engage with our private sector counterparts in service of public health goals. There's very much a bit of a traditional public health paradigm that sees health and health care as within the purview of the public sector and the government. And there has been decades of experience and support for the promotion and distribution of free commodities, both in the public and NGO sectors. The traditional public health paradigm very much tends to characterize markets as belonging to the private sector, as accessible only to wealthy populations, and not really a viable strategy for reaching poor and vulnerable communities. While I do think that there is increasing evidence to suggest that's not totally accurate, I do think that the strengths of the public health paradigm lie in their emphasis on access and equity. However, there remain real challenges with the quality or perceived quality of services in the public sector and their reach, both due to resource and geographical limitations. So, on the converse side here, or conversely, the market paradigm tends to view the distribution of reproductive health commodities very much akin to the distribution of other commodities. In most cases, not all, in most cases, it will select for the most efficient use of resources. The market paradigm recognizes the potential for markets to fail and consequently places emphasis on sustainability and efficiency. So what is the value proposition for advocacy for market strengthening? I offer this value proposition to you all. And that is, I believe we have the real opportunity to establish the experienced networks of health advocates and public health professionals and their emphasis on access and equity, combined with the market resources and market resources, including technical and fiscal and capabilities, with its focus on efficiency and sustainability to improve access to quality, sustainable reproductive and maternal health programs. So, getting to the meat of our presentation here in the abbreviated version, what are some sample total market approach advocacy objectives that our joint working groups could take forward concretely in the future? We think that there's real opportunity in several areas, including the government stewardship of the total family planning market. And so we've offered one sample advocacy objective in consultation with many of our colleagues who implement total market approaches at the country level. This sample advocacy objective is the National Ministry of Health, RH Division, will expand the National Coordinating Committee for RH to include participation of key commercial sector FP stakeholders by June 2016. Two additional advocacy objectives for your consideration, this in the realm of financial sustainability for family planning. And you'll notice that these two advocacy objectives are sort of two sides of the same coin, both targeting decision makers within the public sector and within our key commercial sector stakeholders. The first is key commercial sector FP suppliers will share forecasts and sales data quarterly and annually with the National Ministry of Health RH Division starting in January 2016. The National Ministry of Health RH Division will consolidate nonprofit and commercial FP data into its planning and forecasting to better inform costing of public sector FP services and products, including procurement and distribution for FY 2016. And while you'll notice in these sample advocacy objectives, we've endeavored to make them smart, so we've made them time-bound and we've ensured that they have targeted decision makers. But these are sample total market approach advocacy objectives that we believe offer real opportunity for collaboration between our two working groups. Thank you for tuning in to this abbreviated version.